Hey mama, today I'm going to share with you my positive hospital-based birth story of my second born. The reason why I really want to share this story is because so many women fear having a hospital-based birth if they want to have a birth that they feel like they have control over and that can be gentle and reduce birth trauma. And as a pelvic floor physical therapist myself, mom of two, soon to be three, I really find that it's important to share all types of birth stories, not just positive home birth stories, but also positive hospital-based birth stories. You'll have to forgive me. I gave birth to my second born 15 months ago, and so I need my computer for some notes. Also, little tip, if you want to remember your birth story, take notes on your phone right after while you're still in the hospital, just like a sweet little sentimental thing. I'm so glad that I did for both my births because I'm telling you, your brain automatically forgets your birth within a couple of days. It's like we are designed to release hormones to just like forget about any potential negativity that happened during childbirth. That way you want to have more babies. So make sure you take your notes if that's something that you want to remember and share with your babies one day. Okay, so this is my second birth. So I was 40 weeks and 5 days the day before I gave birth. So I was 40 weeks and 6 days the day that I gave birth. This is my second vaginal delivery. And I remember I was so bored. It was September, or I guess it was the last day of August. And it's still really hot out and I just didn't want to be inside anymore. And I was kind of done playing the waiting game. And so we actually went to a college football game. Both me and my husband went to Vanderbilt University. He played football there. And so we actually went to the game. And it was during the middle of the day. We brought she was 2.5 years at the time. So we brought our 2.5-year-old. And I remember seeing so many of our friends who were like, I can't believe, like, you're massive. What are you doing out at this Vanderbilt football game? Like, it is so hot. Are you sure you should be here? It's like, actually, the hospital's a lot closer to the stadium than to my house. So I feel pretty darn safe where I'm at right now. Plus, I got a lot of sympathy, a lot of free water from the people at the football game. But we actually didn't make it through the full game because my 2.5-year-old just didn't want to be there. And so we came home, just relaxed on the couch, didn't really do much for the rest of the day, watched the rest of the game. I do remember, though, I had a really hard time sleeping kind of the week, maybe 2 weeks before. And so I was trying to do some gentle birth prep mobility flows every single night, as well as take some magnesium to help me just like relax. And I feel like that was my body's way of saying like, hey, birth is near if you're like not sleeping well. So I did a birth prep mobility flow from my labor and delivery program and then took my magnesium at night and went to sleep. And I do remember I also kept waking up with cramps kind of in the middle of the night, but this has also been happening to me for the last couple of weeks. So I just thought, oh, just more like fake contractions, more Braxton Hicks contractions. Like, I'm sure it's nothing. In the back of my mind, I was hoping it was something though, because I didn't really want to go past 41 weeks and I was already 40 weeks and 5 days. And so I had actually scheduled a cervical membrane sweep for that Monday. So it was Saturday of the football game, Sunday when I gave birth, and I actually had a scheduled membrane sweep on that Monday to try and induce labor without having to receive Pitocin as like the most aggressive form. So I wanted to start with a membrane sweep. So I was really hoping that I would go into labor without needing that membrane sweep, and voila, it happened. So I was having those cramps kind of overnight, wasn't really sleeping well. And so finally got out of bed at 4 a.m. My husband was still in bed and I got to the sofa and just started doing some computer work. I was like, what else am I going to do? Being a solo entrepreneur is like struggling thinking about maternity leave. So I just wanted to get even more work done. And then I actually started having more regular contractions at around 6 a.m. And they were like 15 minutes apart. So they were getting pretty close, but they weren't really intense yet. And so my husband woke up and my daughter, we got her up. She normally wakes up, 6 a.m. That's the toddler life. And we decided it was Sunday morning. So we always do kind of like a big Sunday breakfast. We had cinnamon rolls, bacon, the family, and my contractions started getting closer. So that's when I looked at my husband. I was like, okay, I think like I'm actually in labor, but I didn't get to experience this with my first birth because my first birth, my water broke before I was ever in labor and I had to go to the hospital. So I didn't really know what early contractions, like with my waters intact, felt like. I'm like, these don't feel strong enough, but okay, I guess like I'm in labor. I was timing them. They're getting closer and closer together. So then we started collecting our stuff and had our babysitter come over at 9 a.m. and left the house by 9:30 to drive into Nashville. Only like a 25-minute drive from where we live. And so we arrived to the hospital and checked in at triage around like 10 a.m. And that's when I had my first cervical exam. So I personally declined cervical exams throughout my pregnancy because they don't predict when you'll go into labor. Yes, they tell you information about how dilated you are or how effaced your cervix is, but there's no correlation between how dilated and effaced you are prior to labor and when you will go into labor. It could literally be, you could go from 1 centimeter with no contractions to 6 centimeters the next day, or you could be stuck at 1 centimeter and then have to be induced 2 weeks later. So there really isn't a strong correlation. I just find them pretty uncomfortable too. And so I was like, you know what? I'm just gonna skip all of it. So I had my first cervical exam when I got to triage, and I was actually 7 centimeters dilated already. And I was just so shocked because I was expecting to be in more discomfort. And like I said, with my first birth, I never got to experience what contractions felt like with my water intact. And so it's like, oh, this isn't like too terrible. So I was still in triage when my doula arrived. I like hiring a doula, even though it's my second birth. It's just really helpful to have someone in the room also advocating for you. So it's just me, my husband, my doula. And we were in triage and we finally got back to the room. Also, the thing to know during triage that I had to advocate for myself is getting out of the bed. They're pretty quick to just like put you in bed, hook you up to monitors, make sure you're actually having contractions, and they'll kind of forget about you and leave you sometimes. And so once like the 15-minute period that they needed for the time strip was up, it's like, okay, someone unhook me, please. Like I want to get up and move around because it's honestly uncomfortable to lay flat on your back while you're having contractions. So I had to advocate for myself for that. But yeah, we got back to a labor and delivery room. I asked for a peanut ball and a round ball, and we started filling the tub. I just wanted all of the things. I really enjoyed laboring in the tub. They don't let you birth in the tub where I deliver, but I stay in there for as long as possible. And things that kind of slowed down on the drive over from our home to the hospital. So I was trying to change positions pretty often to potentially create more space in different parts of my pelvis. And so it was about 12 p.m. Remember, we got to the hospital around 10. So it's about 12 p.m. where I asked for another cervical exam. And at that point, I was 70% effaced and 8 centimeters dilated. So I hadn't really dilated that much, but my waters were still fully intact. And I was at station -2. Yes, I asked for all this information, and that's why I wrote it down, so I would know exactly what that was. So -2 is pretty high in the pelvis. So baby wasn't super low yet in the pelvis, even though it was 8 centimeters dilated. But I kept changing positions, getting in and out of the tub. And at that point, labor ramped up kind of like after that cervical checks, almost as like my mind knew that I was getting closer. And so I hit transition, or what's called transition, when I was in the tub. And I did almost all of it in the tub and only got out for one more cervical exam. My waters were still intact at this point too. So truly like shocking to me to experience one labor with water and one labor without. And so at that point, I asked for a cervical exam. I was like, all right, I'm getting to a point where like, I don't know if I can do this anymore. I hadn't had any pain relief or medication yet. And so it was 2 p.m. She checked my cervix, 9 centimeters dilated, station -1. So I was like slowly moving down, and there was just like a little bit of cervix left. And at that point, I asked her, okay, if you break my water, in your experience, my midwife, when will I deliver? And she goes like within 15 minutes. Like you are so close. I think it's like your water that's kind of like your bag of water that's making it difficult for your baby to descend. So I'm out of the tub. I'm like near the bed. I was like, okay, just break my water. Just do it. Granted, this is only 2 p.m. I only got to the hospital at 10. So like I'm just being impatient because it's only been 4 hours compared to my first labor, but I was so ready to meet my baby. So then we pretty much get to pushing. Like she broke my water, and I kid you not, I got on the bed in all fours and almost immediately felt the urge to push, which was also new to me because last birth I had an epidural and didn't really feel that natural urge. And so I was just like, oh, this is happening. Like I can't stop it. My body is just pushing. I pushed 2 times, so I'm in all fours, and his entire head came out. Like, normally there's like a slow crowning process. No, like it was 2 pushes and his whole head came out. And this is when it got like a little scary for a second, because apparently his shoulder was stuck. And so I'm in all fours, head's out, and they see it like his shoulder's stuck and kind of like the cord is like wrapped around a little bit. And so the best like way, I guess, to release a stuck shoulder is like in a side lying position. You bring your one knee like all the way to your chest. So my midwife was super calm. She's like, I'm gonna need you to flip over. Just very calmly. She didn't like freak out or anything. And then she brought my like leg basically all the way to my shoulder. I pushed again. She's like, I need you to push as hard as you can. And his whole body came out. Like, there wasn't like a slow release whatsoever, which is also so different because my first birth was like slow and controlled, and my husband was able to catch the baby after the shoulders came out. Like, it was just such a different experience. This was like rapid fire. Within 3 pushes, baby just like flopped out. So they saw the cord was wrapped around his neck, like lightly. It wasn't super intense. I started skin to skin. They obviously unwrapped the cord, and the cord stopped pulsing within about 5 minutes. So then we cut his umbilical cord. Sometimes it takes a lot longer for the cord to stop pulsing, so people might wait a lot longer. But mine stopped pretty quickly. So I'm doing skin to skin. I tried pushing out my placenta and was just too tired at that point. It was like I said, it was like rapid how fast he came out. And so I just allowed my midwife to pull a little bit and give some Pitocin, which helps to like stimulate the uterine contractions to help deliver your placenta. And the placenta came out 10 minutes after he was born. And this is where things got a little nerve-wracking again. But after the placenta came out, I was having a ton of big clots, like baseball size clots that were coming through. And so they gave me Pitocin to try and stimulate the uterine contractions, like get everything out and stop the bleeding. That wasn't enough. So then they gave me what's called methergine. I don't know if I'm messing that up. Methergine, but it's a medicine that helps to stimulate the smooth muscle of the uterus. And it's a shot into the muscle of your thigh. And so they gave that to me intramuscularly to stimulate those uterine contractions to stop the bleeding. So I was kind of experiencing a little bit more pain than I did after my first birth, even though it was technically a more natural, quote unquote, process, because I had Pitocin that was stimulating uterine contractions, and I had this methergine. So I was like having a ton of really strong, intense uterine contractions while doing skin to skin and getting my baby to latch, which also stimulates uterine contractions. So I had like 3 different hormones and medicines coming at me to get my bleeding to stop. And it did without needing to do any sort of transfusion. But I was in a ton of like discomfort in my belly from like continuing to feel those contractions. They finally got it to stop. And I wrote in here, my after pains were an 11 out of 10. So apparently your after pains can increase more with subsequent births. A lot of my friends and patients have said that and can confirm this happened to me. It made it slightly hard to enjoy that golden hour at first, but my doula went and got me a heating pad, and they gave me, I think, just ibuprofen and Tylenol, the classic. They won't give you any of the hard stuff when you're in actual pain. So they just gave me ibuprofen and Tylenol. 20 minutes later, with heated blankets, we were able to control the pain. So it felt like it was an eternity, but it really was only like 20 minutes. My doula was a saint. She literally ran to the like CVS or Walgreens right next to the hospital and got me that heating pad, and it helped a ton. And then after that, we were just in the hospital. We had to stay 2 nights because I have GBS. I was positive my first and my second, which is pretty much just a bacteria that naturally occurs in your like a intra-abdominal and vaginal space. And if your baby gets GBS, it's a lot more riskier for them. And so they want to make sure that your baby doesn't show signs of infections in those first 2 days. So they made me stay 48 hours, even though the hospital policy where I am, I could have left after 24 hours if I hadn't had GBS. So I stayed there for 2 nights. Honestly, didn't mind it because it's kind of like a little break from toddler life. But I was eager to get home because those hospital beds are just not comfortable. But yeah, we didn't have our toddler come and meet baby there. We wanted to bring our baby boy home and have her meet him in her own space, and she absolutely loved him. But yeah, that's my positive hospital birth story. I know there was like a couple of moments of intensity, but I didn't have any sort of perineal tearing. I was pretty much in a lot of comfort. I wasn't in a lot of pain until the very end from the discomfort of truly pushing out your baby. But I just wanted to share a positive hospital birth story because sometimes people think that you will have an episiotomy or you will have severe perineal tearing or you can't push in a position that you want. One thing I did forget also, or I think maybe I mentioned this, my midwife applied a warm compress at my perineum to help reduce perineal tearing. That's something that you can ask for, and we had talked about that beforehand. But those are all things that you can do for a positive hospital birth.